my name is Jocelyn Salomon. I am from Group 16. So for today, I'm going to perform a return demonstration regarding oxygen therapy by nasal cannula. So this is a treatment that delivers oxygen gas for us to breathe. So in line with that one, let me proceed to the preparation. First, we're going to determine the needs for the oxygen therapy, verifies the order for the therapy. So in verifying the order, we need to check for the doctor's order, and also we're going to check for the prescribed rate of the oxygen. And then after that one, we're going to perform a respiratory assessment to develop baseline data if not available. So assuming that I already have the baseline data of the patient, so we're going to prepare the patient and support the people. So in preparing the patient, I'm going to assist him into a semi-fowler position. So, hi sir. So, okay lang ba sa imo kay assist ka sa tama na posisyon? Okay. Thank you. Then after that one, I'm going to inform the patient that the oxygen is not dangerous as long as safety precautions is observed. So, sir, kaning buhaton ako karon na sa imuha kay safety ni as long as ang mga tao nakapalibot sa imuha maminaw pod. So dapat kabalo mo unsay bawal ug dili. Unya ingon ako na sa inyo ha o kauban imong ang mga tao nga nakapalibot sa imuha. Okay po? Then after that one, we're going to explain to the client and support people regarding the safety precautions connected with the oxygen use. So sir, since maghatag man ko sa imo or oxygen therapy, so please lang ko bawal magsigarilyo dool sa imuha, and make sure na hinlo ang imuhang palibot. So if ever na ay magsigarilyo nakauban nimo, ingnan lang nato sila palihog na dili sa imuhang room. Thank you. So after that one, let me proceed to the performance. So prior to performing the procedure, introduce self, verify client's identity using the agency protocol. So, maayong buntag sir. Ako ay si Jocelyn Salomon. Ako ay muhang student nurse for today. Pwede ba ko mangayo sa imong pangalan?
Eugene.
Eugene, pwede ko matanong sa imong wristband? Thank you. Then after that one, we will going to explain to the client what we're going to do, why is it necessary, and how he or she can participate. So, sir, mag-administer sa imuha og oxygen therapy since naa ni siya sa order sa imuhang doctor, which is kailangan sa imuhang body. And sa pagbuhat ako sa procedure, kailangan ako og imuhang kooperasyon. Okay lang ba sa imuha? Okay po. Thank you. Then, after that one, we're going to discuss how the effect of the oxygen therapy will be used in planning further care or treatment. Then, after that one, we're going to perform hand hygiene and observe other appropriate infection prevention procedure. So, then we're going to provide for the client's privacy appropriately. So assuming that I have already closed the door in here, then I'm going to proceed to setting up the oxygen equipment and the humidifier. So assuming that this is my equipment, so first we're going to attach the flow meter. We're going to attach the flow meter, this one, to the wall outlet or tank. So make sure that your flow meter is off position. So I'm going to attach this one later. So let me just show you. So then if needed, we're going to fill the humidifier. So we're going to fill it before coming to bedside. So after that one, we're going to attach the humidifier bottle to the baseline of the flow meter. So attach the prescribed oxygen tubing and delivery device to the humidifier. So, this one. Then after that one, we will going to turn on the oxygen to the prescribed rate and ensure the proper functioning. Huh? Then we're going to check the oxygen if the oxygen is flowing freely to the tubing. Then after that one, we're going to set the oxygen at the flow rate ordered. So next, we're going to for the application of the appropriate appropriate oxygen delivery device. So assuming that this is my cannula. So in my improvised cannula. So we're going to put the cannula over the client's face with the outlet prongs fitting into the nares and the tubing hooked around the ears. So sir, magbutang po sa imo og cannula. And if the cannula won't stay in place, we're going to put a tape on the face of the client, to the side of the face of the client. So, then after that one, we're going to pad the tubing and bend over the ears and cheekbones as needed. So after that one, we're going to move to the assessment of the client. So first, we're going to assess the client's vital signs, level of anxiety, color, ease of respiration, and provides support while the client is adjusting for the device. So assuming that I've already checked for the client's vital signs, I already provided support. Then after that one, we're going to assess the patient every 15 to 30 minutes depending on the client's condition. So, and also we're going to assess the client regularly for the clinical signs of hypoxia, tachycardia, confusion, dyspnea, restlessness, and cyanosis. And lastly, we're going to review oxygen saturation or arterial gas results if it is available. And also, next we're going to proceed to the assessment of the nasal cannula. So first we're going to assess the client's nares for the incrustation or irritation. So, thank you. And then we will going to apply a water-soluble lubricant as required to soothe a mucous membrane. So assuming that I have already put the water-soluble lubricant. So next is we're going to assess for the client's ears to see if there is irritation from the cannula tubing. And if there is any irritation, we're going to put pads or the gauze pad to eliminate or to help the client relieve discomfort. So, sir, okay lang ba i-check na ko if na irritation? Thank you. So, assuming that there is no irritation, so after that one, we will going to inspect the equipment every 30 minutes or whenever providing care to the client. And then we're going to check the flow of the or the liter flow or the level of water in the humidifier in 30 minutes or whenever giving care to the client. So make sure that the safety precautions are being followed while the client is having the therapy. Then after that one, we will going to perform hand hygiene and do aftercare. And lastly, we will going to document all the findings to the client record using forms or checklist supplemented by the narrative notes when appropriate. So that sums up my return demonstration regarding the oxygen therapy by nasal cannula. Thank you.